How do I prove that I've been actively listening? What's the best way to prove that I am gathering information? And how can I use echoing and summarising effectively to take my score to the next level? We're going to cover all this and more today in today's video, the OET speaking test, active listening, echoing and summarising, pass or fail. Hi, my name is Richard Foster. I'm a senior trainer and assessor for Benchmark Education Solutions. Today, we're going to talk about how to max out your score by utilizing the skills of echoing, summarizing, and active listening. These skills are really easy to learn, but watch out for a little trick that I show you where you can turn what is perhaps an old skill into one that will gain you more marks. Let me take you over to my computer and I'll show you exactly what I mean.
Okay, so here we are at the computer screen. You'll recall, if you've seen these videos before, this is a roleplay card we've used in the past. Just to give you a quick background, this is a case of a parent coming in with a 2-year-old little girl who has been suffering the flu, but also now is diagnosed with croup. Now we're going to think about active listening and summarising and echoing. So let's imagine the conversation first, and then we can talk about where we might use those skills. So let's imagine this. You've done the greeting with the patient, you've asked the patient's name, you've asked the daughter's name, and in doing so you've acknowledged both of the people in the room, in this case a parent and a child. Now you ask the patient what brings them here today. So the father, in this case, or the mother, might respond by saying, "Oh yeah, doctor, I've had this real problem with Lucy. She's had the flu for a couple of days, and last night when we put her to bed, she started coughing, and it was really distressing. She couldn't breathe, and she started making this weird noise, a bit like a dog barking. It was really frightening. And now this morning, she seems to have a temperature, and she has a problem swallowing. Is there anything you can do to help, doctor?" So that might be a typical opening to a conversation where the patient is, in this case, a little emotionally describing a distressing situation about his daughter not being able to breathe properly and making a weird barking noise. Now, the roleplay card says, after examination, you diagnose croup. However, bearing in mind that we're talking about echoing and summarising as well as active listening. Now, as we've just said, the parent's vocalization of the symptoms is probably quite emotional. So you really wouldn't want to interrupt because it could be offensive and it could hurt their feelings, but it also might mean that the parent doesn't give you a full description, which after all is what you're after. So during the conversation, let's first think about active listening. The parent's now telling you these things. It's a good idea simply to make noises like, uh-huh, oh dear, oh, Richard, I'm sorry to hear that. Oh, poor Lucy. Do you see what I mean? Oh, doctor, yeah, last night she stopped breathing and she really had a problem breathing. Oh dear, I'm sorry to hear that, Richard. Do you see what I mean? You're making little comments where you're not interfering in any way with the flow of the conversation from the patient, but you are acknowledging to the patient that you are actively listening. It's clear by you continuing to make those little brief acknowledgements of what the patient is telling you that you are actively listening. Now, one point to bear in mind, of course, is that during the exam, the whole exam is being recorded, but audio only. The only way that you can prove that you've been actively listening to the examiner, who will only hear what you've said, is to make those little statements. And a little tip, try to make sure don't overdo it, and also don't do it in a way that interrupts the flow of the conversation. So that's active listening. Now, just to extend that a little further, you can actually make those types of noises throughout the whole of the conversation. You maybe ask the patient some more questions, and as they're answering the questions, you may say something like, uh-huh, oh, right, okay, that makes sense, or I understand. Those little phrases, again, you can use them at any time throughout the whole of the 5 minutes, and the examiner will pick up on your use of active listening. So let's talk about those skills of summarising and echoing. Now, if you read the OET exam criteria, you'll see that really this is about confirming understanding of what's been said. So it's a question of you confirming that you can understand what the patient has told you, but it's also a skill that you can use to confirm that the patient has understood what you have told them. So again, let's think of an example conversation right now. Let's imagine we're back in this conversation with the parent. So now the parent has already given their explanation of the symptoms, and you've been using active listening to confirm that you're paying attention. So the patient has now finished describing those symptoms. You may now say something like, okay, Richard, so let me get this right. Lucy's had the flu for about 2 days, but last night she had a real problem breathing, and she was coughing hoarsely. And in fact, you said something like she was making this kind of barking noise like a dog. Is that right, Richard? Oh, yes, doctor, that's right. And, the other thing was, you mentioned that now this morning she has a problem breathing a problem swallowing, and she has a fever. Have I covered everything? Oh, yeah, doctor, you've got it, absolutely. Now, did you notice I simply summarised what the patient had told me? I didn't really go into much detail. I just used their words to confirm that I have understood. So, for the exam, you're getting marks for the use of those skills, for one thing, echoing and summarising, but you're also getting marks for gathering information. Echoing and summarising is evidence that clearly you've been listening, and also clearly you've been taking the information in a meaningful way. So you're getting marks for echoing and summarising in the use of those skills. You're also getting marks for gathering information. Now, the third point is it also gives you an opportunity to, the patient an opportunity to fill in any gaps. It may be that you've misunderstood something the patient told you. The patient can then correct you. It's always a good idea, once you've been using summarising and echoing anyway, to simply say, is that right? Have I covered everything? And that gives the patient an opportunity to fill in any gaps. And that is also about good communication. Now, of course, during this whole process, and we talk about this in another video, it's a thing that causes or gains marks, the use of empathy. Make sure that throughout this you're showing fellow feeling, an understanding of what they may be suffering. Now, we mentioned that there are 2 opportunities when echoing and summarising might be used. We've mentioned the first one early on in the conversation. Now, we talked about maybe utilising a skill you may already use in your everyday practice, but one with a little bit of adjustment where we can help you gain even more marks. And that's in the end of the conversation, where normally you may summarise your a kind of a statement of what you've discussed during the conversation. So you might normally say something like, okay, Richard, we've covered a lot of stuff today. Let me just summarise what we've talked about. Oh, okay, doctor. And then you go ahead and make a summary. However, remember, during the exam, you are being marked on giving information. You're also being marked on checking the patient's understanding. Now, again, we go into the checking the patient's understanding in a little bit more detail in another video, but let me give you an example of how that old skill, that old practice of the doctor summarising or the nurse summarising what's been discussed, and convert it so that we're getting the patient to summarise. Let me give you an example, and then let me tell you the benefits of doing it. So you might say something to the patient like, okay, Richard, we've covered quite a bit of information today. I just want to make sure we're on the same page. Would you mind just summarising your understanding of what we've discussed today, just to make sure that we've covered everything? Oh, okay, doctor, yeah. So you think Lucy's got croup. You've explained that it's a virus of the airways, and you also mentioned that you're going to give us some, I think you said oral corticosteroids to help with the swelling, and also some painkillers to help with the inflammation and the pain. And you also mentioned that if she turns blue, that's quite dangerous, and I need to bring her back straight away. I think that's everything, Doctor. Have I missed anything? No, Richard, that's excellent. Well done. But don't forget the follow-up appointment as well. I'll be seeing you in about 2 weeks. Do you see the benefits of doing that? By asking the patient to summarise, first of all, you are getting marks for checking the patient's understanding. The fact that the patient is able to repeat them back to you is strong evidence also that you've successfully given information. It means you've done a good job of giving information because now the patient can repeat it back to you. That means you've communicated clearly. The second thing is you're being marked for checking the patient's understanding. Therefore, what better way is there to simply ask the patient to explain what they've understood? Now, of course, you can use the skill of checking the patient's understanding throughout the whole of the conversation. You know, you might say something like halfway through, does that make sense? Do you understand? Am I making sense? You know, words to that effect. So you are checking the patient's understanding throughout the conversation. However, the end, asking the patient to summarise their understanding at the end, very clearly demonstrates those skills. Now, as we said earlier, at the beginning, when echoing is used by you to summarise your understanding of what the patient has said, there are benefits in that now you can fill in any gaps that the patient has missed. This means, you know, the patient has just repeated back their understanding of what you've said. However, maybe they missed something. Maybe they misunderstood something. Now's your opportunity to fill in those gaps and confirm their understanding again. Now, one final thing just worth mentioning. They are 2 examples of when you might use echoing and summarising, early on and then towards the end of the conversation. However, be aware that the roleplay card may influence you to adjust your approach with those things. One situation in particular might be where the roleplay card background information says that the patient has just been given maybe a terminal diagnosis of cancer, for example. To, in a very upbeat and jolly voice, ask the patient, would you mind summarising your understanding of what we've just said at the end of the conversation? It may not sound so appropriate or so natural. Or it may be that you've had an angry patient and you really don't want to provoke them by some pleasant little comment about asking them to state their understanding. But you can still use the skill. You can still say something like at the end of the conversation, something like, Richard, I just want to make sure you do understand why it's so important you start chemotherapy, don't you? Again, the main point of the conversation is about the fact that the patient has a terminal diagnosis of cancer, and that will be revealed in the roleplay card. So the main thing you really want to check that the patient has understood is the most important part of that conversation. In that case, it's making sure that the patient commences chemotherapy straight away. But do you see the point? Or if the patient is angry, you may simply say, Richard, you do understand why we can't disclose information about your wife's condition unless we have her permission. You do understand the reasons for that, don't you? Do you see what I mean? So it does make sense to just pay attention to the setting and the background information. But that really covers some good uses of the skills of echoing and summarising and active listening. So I hope that really helps you today. I'd certainly advise you to continue to practice and get used to using those skills. Even if you start by using them in the beginning to summarise your understanding of what the patient has told you, and then think about asking the patient to summarise their understanding of what you have told them.
I hope that makes sense to you today. Let me just summarise what we've covered. We talked about active listening, where just making those noises of okay, sorry to hear that. Little phrases that don't interfere with the patient's conversation, but confirm that you are still listening to the patient. We then talked about echoing and summarising. Now, we've learned that those skills can be used throughout the whole of the 5-minute conversation with the patient. However, we also discovered that there's two particularly good times when we can use that. So that's at the beginning, when the patient has just described their symptoms to you, where you're simply summarising back to the patient your understanding of what you've heard. And then at the end of the conversation, if appropriate, you can ask the patient to summarise their understanding of what you've been speaking about during the conversation. Now, one of the other benefits, of course, to echoing and summarising at the beginning and at the end is it gives you and the patient an opportunity to reveal or fill in any gaps that may have been missed. For example, when listening to the patient and repeating back your understanding, you may have missed something that they've told you. Or at the end of the conversation, when you're asking the patient to confirm their understanding, it may be in repeating things back to you, they miss something. And again, you can fill in the gaps. So, we are really trying to put together as many of these videos as possible, and we hope you're really benefiting from them. But can I say there's nothing quite like a one-to-one conversation. As you know, I can take you through a full mock test under exam conditions, where I will reveal to you and give you feedback about the specific areas of your skills, your clinical communication skills that may need some work. Next time, we're going to speak about creating a plan, developing the conversation in a logical, structural way, and also we're going to discuss the skill of using signposting. Can I ask you please to hit the subscribe button if you haven't already, hit the like button, but particularly hit the notification bell so that you get all the videos that we're releasing, so that you get notified of them. It's been really nice speaking with you. As I said, my name's Richard Foster. I'll see you in the next video.